Hi, my name is Tammy Herrera. I'm from the village of Puwadi. I'm a lieutenant with the fire department and contact tracer and public information officer for the Pueblo of Laguna Emergency Operations Center.
Hi, I'm Christylee Kie. I'm from Sita Village. I'm lieutenant with the Laguna Fire Department and testing coordinator for the EOC.
This educational video is created to assist our community in understanding what COVID-19 testing entails, what contact tracing means, and why these are important for the health and safety of our community.
Before we begin, we'll provide you a quick review of the basics of COVID-19 and its origin. The basics of COVID-19. Coronavirus is a large group of viruses. To see these, scientists use a very powerful microscope. They identify these groups of viruses by its crown-like shape. The viruses infect a wide range of mammals and birds, and some cause mild respiratory illness.
The origin of SARS-CoV-2 is a new coronavirus that originated in bats and emerged in Wuhan, China in 2019. These special coronaviruses jump species and have transmitted between people. This is the third new coronavirus to have done so since 2002. SARS, or Severe Acute Respiratory Syndrome, was the first to be identified in 2002 and emerged in Guangdong, China. It was followed by MERS, or Middle Eastern Respiratory Syndrome, which emerged in 2012 in the Middle East. What happens to people after they get infected with SARS-CoV-2? SARS-CoV-2 is the virus that causes the illness we call COVID-19. Not everyone who is infected will get sick. These people are identified as asymptomatic, or people who don't show any signs or feel any symptoms. They basically carry the virus without knowing it. If someone does get sick, there will be many questions like, what are the signs and symptoms? Who is at higher risk for severe illness? How long does the illness last? And how long can people be infected and spread the virus? Where and how do people shed the virus? We will cover these questions later in the video.
In this section, we'll review different types of COVID-19 tests. The first we'll review is used to identify an active infection. This is called a diagnostic test, which identifies viruses in the body. The test gives a sign that the virus is reproducing in your cells. A swab is taken from your nose, and the sample is sent to a laboratory for testing. A positive test means there's an active infection and shows virus particles in the sample. The Pueblo of Laguna has administered diagnostic testing in 3 main areas of our population. This includes 1. Essential workers. If you have been identified as an essential worker, you may be required to test to help establish the health, safety, and wellness for the workforce as a starting point. This will help us to better monitor possible exposure as the Pueblo begins to open up. 2. Community and voluntary testing. The Laguna EOC has set up multiple testing sites within the Pueblo to allow community members to test voluntarily. And 3. Possible exposures. Testing for possible exposure is for those individuals who may have had contact with a possible case of COVID-19 or traveled on non-essential business to an area with many positive COVID-19 cases. Along with diagnostic testing, there is also another test that can identify active infection much more quickly. This is called rapid testing. Rapid testing allows for quick results within a few hours. This test is currently not available at any of our scheduled test sites. The final type of test we'll review is used to identify past infection. This is called an antibody test. A sample of your blood is taken and sent to a laboratory to look for antibodies your body developed to fight off the virus. A positive test means you were infected with the virus in the past. It does not tell you when you were infected. It could also mean that you have developed some protection from future infection, but scientists are not yet sure. The Pueblo does not currently offer this test, and it is still not widely available right now. Remember, no test is perfect, and the timeline to receive your test results may vary from 2 to 5 days for the diagnostic test. Now let's review isolation versus quarantine. Isolation means that we are trying to keep sick people away from healthy people. Isolation may take place at home in a separate living area and away from your family. Your isolation will end when your symptoms begin to improve. You've had no fever within the past 3 days without medication, and you received 2 negative tests 24 hours apart. If you have been told to isolate, this can mean 1. You have tested positive for COVID-19, or 2. A member of your household tested positive for COVID-19 and a test was immediately administered for you as well. Quarantine means that we are trying to restrict the movement and contact of healthy people who may have been exposed to the virus so we can stop it from spreading. Quarantine may last for 14 days since the last contact with a person who is infected. If you have been told to quarantine, this can mean 1. You may have come in contact with a person who is infected, or 2. You may have traveled on non-essential business and have been asked to test, or 3. Precautionary measures may not have been followed and you have been asked to test. If you were asked to test, you will remain in quarantine until your test results are received, which is in 2 to 5 days. The POL COVID-19 testing team will also place you in one of these categories. If you are an essential employee, you may continue your regular work schedule. For voluntary testing, such as testing at one of our scheduled test sites, you will be asked to quarantine until your test results are received, again in 2 to 5 days. But don't worry, the EOC will help you through this. If you need anything, please just let us know.
What happens at our POL COVID-19 testing site? At test sites, we require you to stay in your vehicle if you are driving up. We will have a lane for those walking to the test site and you must wear a face mask. When you get there, all our staff will be fully gowned in personal protective equipment. You will be screened, which means you may be asked to give personal information if you have any signs and symptoms, and if you recently traveled. Next, you will meet our testing team. They are skilled professionals who will talk you through the process and administer the swab through your nose. You may feel some discomfort, but only for a few seconds. Some people will have watery eyes or feel the urge to sneeze. After testing, you will begin your quarantine period as required. Now let's take a look at things to look out for if you may have been exposed to the virus.
When someone has an exposure to COVID-19, we look for these signs and symptoms. To explain what those are, signs are things you can see or measure. And for COVID-19, this may include a temperature above 100.4 and breathing faster than normal. Symptoms are what the patient says they feel, like fatigue, nausea, loss of taste or smell, and muscle ache. And a fever is both a sign and a symptom.
Who is at higher risk for severe illness? Those who are age 65 and older, individuals who are obese, those with underlying health conditions like diabetes, heart or lung disease, asthma, or any other respiratory disease. It is important to note that some young, healthy people and children have become severely ill, but this is a small number.
How can SARS-CoV-2 infect others? The first way, an infected person has the virus in their mouth, nose, and throat. The virus will catch a ride on droplets, which can travel as we talk, laugh, cough, and sneeze, just as the picture shows. The droplets can enter another person's mouth, nose, or eyes. It's important to note that droplets can travel up to 6 feet, so the use of face masks can reduce the travel of droplets, and standing 6 feet away from another person together can lessen the transmission of the virus. The second way, surfaces may have viruses from someone's respiratory droplets, and the virus can survive on these surfaces and then contaminate the hands of others. Our hands can transfer the virus through our mouth, nose, or eyes. This is why washing your hands is important.
When someone is infected, how long does the illness last? Utilizing our graph, you can see that when a person becomes infected with the virus, the time it takes for the virus to show itself in a person, also known as the incubation period, can range from 2 to 14 days, but typically 5 days. This depends on how your body responds. Now, we look at the signs and symptoms that begin to show and what a person may feel. This can range from mild to severe illness and even lead to death. There are also asymptomatic individuals who are more difficult to identify. As a reminder, asymptomatic means no noticeable symptoms. Next, we look at the timeline of infection. The infectious period is the time when someone infected with SARS-CoV-2 can pass the virus on to other people. This period starts 2 days prior to when symptoms start. This person is most infectious at day 1 of symptoms and less contagious as time passes. After a person's infectious period is established, we now have a period of time to work with to help us identify any other people who have had close contact with this person. There are 3 kinds of contacts we look for, which include anyone who had physical contact, anyone who had close contact, meaning they were within 6 feet of the infected person for at least 15 minutes or more, and lastly, anyone who had proximate contact, meaning they were more than 6 feet apart but were in the same room for an extended period of time. The most important part of the investigation begins when a positive case is identified and any individuals they have been in contact with. The infected contact begins their incubation period when they come in contact with the positive case. There is a very short window of opportunity before the contact becomes infectious. Looking at the slide, we use a 5-day incubation period. The infected contact has 3 days in which they are not yet infectious. Contact tracers must work fast to identify these individuals and put them in isolation to stop the virus from spreading. What is contact tracing and what does it entail? If we receive a positive result, we will begin something called contact tracing. Contact tracing is a process of identifying people who may have come into contact with an infected person. We will then begin to work with you to collect information about people you may have been around and also place these people in isolation. The main purpose of contact tracing is to isolate infected people and their contacts to slow and stop the spread of the virus. Now let's talk about treatment of COVID-19. There is no specific treatment to cure COVID-19. Health professionals can only treat or manage symptoms until the immune system can fight the infection. That means a person may only need to take over-the-counter medication such as cough syrup or Tylenol. In more severe cases, there may be a need for a ventilator. Many patients with lung disease require a breathing machine or ventilator to help them. People who need a ventilator will receive support to keep their lungs functioning so the body can continue to get the oxygen it needs. Finally, let's talk about how you end isolation after testing positive for COVID-19. When all symptoms have subsided or when the appropriate amount of time has passed, your contact tracer will work with you to get you tested again so you can get back to your life before you became infected. You will be required to have 2 negative tests at least 24 hours apart before you are cleared to stop your isolation. We hope this video was informative and helped you to understand how we have been working to keep you and your family healthy and our community safe.
For questions about testing, call me at 221-4028.
And for all other questions COVID-19 related, you can contact the Laguna EOC team at 505-328-5682. Or you can email us at covidinfo, COVID-info @pol-nsn.gov. Thank you.